So because of this phenomenon of 30-year-olds now having lower testosterone, a lot of people think it's just okay to get themselves started on testosterone. And once they get started, they love the effects. Energy's higher, they're no longer feeling depressed or anxious, they're able to put on muscle, so then they continue it without realizing the downstream effects. The issue with that is that your body will then naturally stop producing the hormones that is needed for sperm production. So unfortunately, now you're setting yourself up for failure later instead of investigating why your hormones are low in the first place. Hormone production is fairly complex. It involves your brain, it involves your testicles, involves your adrenal glands. You need to really work with someone that truly understands the deeper meaning. I mean, I haven't had two people with the same reason for low testosterone. That just shows how complex every single person is and why their physiology matters more than just looking at their labs or a quick fix. Metabolic dysfunction is the leading cause of poor testosterone that I see. Increased visceral fat, which is the fat around the organs, seems to be the biggest drivers. When I see late 20-year-olds with testosterone in like the 200s, 300s, which is quite low, that's the biggest reason. And then I'll look at their fasting insulin and it's very high. I'll look at their lipids and it's quite high. So a lot of times I'm not fixing the testosterone at that time. I'll be talking to them about fixing their diet and putting them on like a GLP, talking about exercise, strength training, so that we can see if we can move the needle a little bit. I always tell people the easiest thing I can do is just prescribe you the medication. It's much harder for me to sit there and look through all these labs and try to put together a story that makes sense based on the lifestyle questions I've asked you. That takes a lot more effort than just, here you go, you're done. That's why it's important to find a clinician that will do that work for you. And a lot of the sexual health clinics, a lot of reasons they reach for testosterone is for that ease. And one, they can have a happy customer because people feel great on testosterone. And two, there's very little work involved mentally. So let's just say the why is a young person that has insulin issues, and all you're doing is giving them testosterone. So really at the end of the day, if your body's not going to utilize that testosterone well because it's in a metabolically dysfunctional state. So by not addressing the reasons why, all you're doing is then giving them the medications that's not really going to help them long term. So you're not really helping the person, you're just kind of putting some, powder on it and just calling it like nice makeup. There's 3 different spots that your testosterone can get affected or suppressed down the line. So truly trying to understand where in those processes that it's getting affected is truly important, and that's what I try to do for every patient. My role is not to start you on just testosterone and to have the same treatment for everyone. My role is to understand who you are as a person, understand your goals, and then find the right recommendations and interventions to get you there. I do see myself as someone that puts the puzzle together when someone comes and talks to me. It's something I really enjoy because I want to be able to provide them the answers that they've not received for so long. Testosterone is incredibly important. It's important for heart health. It's important for muscular health. It's important for bone health. Without it, without adequate levels, people feel quite depressed. They can have low energy. They can be working out and have poor recovery. They can be working out and not have that muscle that they're building. Muscle is strength and muscle is quality of life. So if you don't have that key substrate, all you're doing is just making this person work so hard without getting even having a chance of making a difference. So it's incredibly important, and that's why I think as a society we've been talking more and more about testosterone. We just have to make sure we're doing right by the patient and understanding why this is going on, not just give them the medication. Lower testosterone in younger men is often reversible. It does take someone that understands your physiology and what's going on in your body to help you get there, but it is reversible. If you skip the why, you haven't fixed anything. Starting TRT, which is testosterone replacement therapy, too early can take away the body's natural production of sperm. Most people go straight to testosterone replacement therapy without understanding what caused it.